Wilms tumor or nephroblastoma is a malignant embryonal tumor of renal tissue, and about 80% of children with Wilms tumor present before 5 years of age. It can present soon after delivery, or it may be associated with congenital anomalies such as hemihypertrophy, and also the absence of iris, that's aniridia. Wilms tumor has a very good prognosis with an over 80% chance of long-term cure. So the main cause is sporadic gene mutation. The symptoms are visible or palpable abdominal mass, fever, and blood in urine. The signs that are usually elicited are abdominal mass. You have to palpate with care to prevent rupture or dissemination, and also hematuria could be macroscopic or microscopic, and hypertension, and also associated congenital anomalies. Investigations are abdominal ultrasound scan, abdominal CT scan, chest X-ray, full blood count, blood urea, electrolytes, and creatinine. The main objectives for treatment are to obtain long-term cure and also to provide adequate supportive and palliative care. Non-pharmacological treatments include nephrectomy and also radiotherapy post-surgery for advanced cases. Pharmacological treatment for preoperative treatment, first-line treatment, you give vincristine IV, and then you give actinomycin D IV, and then you add doxorubicin IV if there's a presence of metastasis. For post-operative treatment, you give vincristine IV and actinomycin D IV, and also doxorubicin IV, depending on the stage and the risk category. Or you give combination of carboplatin or carboplatin IV and etoposide IV, and also doxorubicin IV and cyclophosphamide IV in a combination as for high risk tumors. And for the treatment of vomiting, you give metoclopramide IV or oral 100 to 400 micrograms per kilogram 8 hourly, or granisetron IV 40 micrograms per kilogram with a maximum dosage of 3 milligrams stat, and you may repeat 12 hourly if necessary. Or granisetron oral 20 micrograms per kilogram with a maximum dosage of 1 milligram within 1 hour before starting the treatment, and then 20 micrograms per kilogram 12 hourly for up to 5 days. Or you could also give ondansetron IV in adults 500 milligrams per meter square stat, and then repeat 8 hourly if necessary. In children as 12 to 18 years, give 8 milligrams stat immediately before chemotherapy. Or ondansetron oral in adults 8 milligrams 8 hourly is administered 30 minutes before starting chemotherapy. For children 12 to 18 years, give 8 milligrams 8 to 12 hourly up to 5 days. From 1 to 12 years, 4 milligrams 8 to 12 hourly up to 5 days. For the treatment of febrile neutropenia, you give ceftriaxone IV 100 milligrams per kilogram daily, and gentamicin IV 5 milligrams per kilogram daily, and also clozacelin IV 25 to 50 milligrams per kilogram 6 hourly. And if the patient is still febrile after 5 days, you add fluconazole oral 10 milligrams per kilogram daily. And for the treatment of anemia and thrombocytopenia, blood and blood product transfusions may be required. Referral criteria: all patients should be referred to specialist centers for appropriate treatment.